Many people do not consider sleep as an important part of establishing function in life. So I think these are the things that are quite important. Well, if you say sleep is for the weak, I think those who master sleep are those who will live another day to fight the next battle. So I don't think it's for the weak. I'm a full-grown Tomasian in terms of my medical career. After finishing my medicine training, I went into pulmonology and pursued a sleep fellowship or sleep training at the University of California in San Diego. After a year, I discovered that it was a totally different field that no one had yet explored as much in the Philippines. So it was a new discovery that would benefit the country because I could bring it back home. A sleep specialist, of course, is someone who involves himself in the area which we spend a third of our lives in, and that's sleep. It's a unique specialty because you need someone to observe you as you sleep. You cannot report that you have a problem during sleep. We can divide sleep into two basic parts. We call it non-REM or N, and REM, which is rapid eye movement. Now, the differences are, N1 is when it's very light sleep. That means someone goes into the room, you wake up. N2 is where we spend 50% of our night in, but N3 is the one that's important. It's deep sleep. So that means even if you sleep for 7-8 hours, but you don't have N3, or the deep sleep, you will feel tired when you wake up in the morning. Now, after around few minutes, you will go into what we call R, or what we call REM sleep. This is where you have relaxation of your muscles, and in this part, there may be increases in terms of the possibility of obstruction of the airways. So some of the disorders of sleep occur during REM sleep. There are over 80 disorders of sleep. When you have too much that you sleep when you're not supposed to sleep, or you have too little, which is defined usually as insomnia. People feel that if you have a problem with insomnia, the treatment is just pop a pill and that's it. It actually entails a whole adjustment of behavior in terms of therapy, in terms of instruction, in terms of how to sleep, and then that's the only time we give medications for patients. We talk about misconceptions. There are so many misconceptions about sleep. Pag humilik ka, tapos natutulog ka, it means it's good sleep. And it's not. When we snore during sleep, it means we have partial obstruction of our upper airways, and it's not normal. Also, a misconception is the hours of sleep as you get older get shorter. It does not. It's that the quality of sleep changes as we get older. What does that mean? We have less deep sleep, so we tend to wake up a lot more as we age. How can we get clean sleep or sleep hygiene? One is to make sure that we sleep regularly in terms of our hours. So it means divide your day into threes. If you wake up at 6 a.m., you add 8 hours. That will be around 2 p.m. You can take a siesta. Then add another 8 hours after that. So that will be 2 p.m. That will be now 10 p.m. That will be the time you should be falling asleep. So sleep regularly. Next is that make sure that when you fall asleep, you only use the bedroom for sleeping. If you read in bed, the body will be confused as to what you really plan to do. Do not have a television set in your bedroom. Do not use your cell phone or your computers in your bed. Make sure your mattress is comfortable. Make sure the temperature is just right. Avoid lights if possible, because with a lot of lights, the melatonin level in your brain may actually go down and make you less sleepy. We have people who work the whole day just to make a living. Therefore, their sleep quality and sleep hygiene is poor. So I think one of my advocacies is to make sure that in the workplace, in school, is that we have good sleep that can be promoted among not only the students but as the workers as well. So those who master sleep can be the ones who will truly appreciate what it means to be awake. So it's not for the weak, but it's for those who want to live a full and satisfied life.